Well, welcome everybody. Welcome to our first day of Demystifying Death Week. This is a week that happens all across Scotland and aims to give us an opportunity to shine a light on death and dying and lots of topics that we might be interested in relation to that. So I'm so excited for tonight's session, something that's really, really interesting. We've done different projects for the past 4 years. Last year, if anybody came along to the body donation for medical science session, which was fantastic and really interesting. And today, we're in that same stretch of doing something useful, I guess, with our bodies after we die, or actually when you're still living as well. So really excited about tonight's session. The format for tonight is we're going to have a presentation for about 30 minutes or so, and then we're going to do some question and answers. I've got some pre-prepared questions, but we'd also love to hear from you guys in the audience. So you can type in questions to the chat function at any point tonight. So that is up the top of your screen. You should see a little speech bubble that says chat, and you can click on that and a chat bar should arrive. If you're not seeing any of that or it's not working, sometimes depending on the browser you use, technology decides to be a little bit funny. If you've got a burning question to ask and you can't add it into the chat, then there's two options. One, at the end of the presentation, you can raise your hand and you can come on and ask it yourself. We can let you have your microphone and your camera back on. Or if that's putting you off because you don't want to be recorded, you can also drop us a little email. My colleague Maureen will pop the email address into the chat, but if you can't see the chat, it's also the email address that was in your original emails that we sent you for registering tonight. ggc.homefirst@nhs.scot, so you can email us as well and we can pick that all up from there. So that's the kind of plan for tonight, and yes, we will get cracking. So as I say, I'm delighted tonight to welcome our guest speaker, Dr. Radha Sudram, and she works at the Royal Alexandria Hospital in Paisley. But I'm going to let her introduce herself and her wonderful topics. So take it away, and yeah, really looking forward to it.
Thank you so much, Jenny. Thank you very much to NHS Greater Glasgow and Clyde's Realistic Medicine team for giving us this opportunity to talk about organ and tissue donation in Scotland. My name's Radha. I'm a consultant in anaesthetics and intensive care at Royal Alexandra Hospital, Paisley. I'm also a clinical lead with NHS Blood and Transplant. And the topic today is it's in the context of demystifying Death Week, but it's about saving lives and giving hope. My own journey, I'm from India and I came to the UK in 1997. I worked my way up the M6 from Oxford to Glasgow, and I've been here for over 20 years now. I have a role with NHS Blood and Transplant as the Diversity and Inclusion Lead. NHS Blood and Transplant are the overarching NHS organisation that coordinate donation and transplantation. I also work in intensive care at the RH in Paisley, and I have the unique opportunity of approaching families about the dying wishes of their relatives. Why are we here? I think it's to sort of raise awareness about organ donation and discuss why it is important to talk about it when we're actually alive and healthy. Also would like to tell you a little bit about the impact of opt-out legislation and also sort of focus on tissue and corneal donation. We have a lot of data that NHS Blood and Transplant collect. And if you look at this graph, it is the bottom, there are these vertical bars, and they actually tell you about the number of donors. So in 2023-2024, we had 1,530 donors in the UK. That gave rise to 3,740 transplants because a donor can save up to 9 lives. But what's most worrying and concerning is that there are still 7,400 people, that's on the dotted line at the top, 7,400 people waiting for a life-saving transplant. As you can see, even though the number of donations and transplants have increased, we're just not able to bridge that gap. This is because we're living longer, and because we're living longer, we are developing chronic diseases like diabetes and hypertension, and we do end up with end-stage kidney disease, with liver disease, and are therefore put on transplant waiting lists. If you look at the number of donors in 23 and 24, donation after death can happen after brain death or circulatory death. And previously, we used to, most of our patients came from brain death donors, but more and more now they come from circulatory death donors. And of course, living donors are also a very integral pool of donors for our patients who are waiting for transplants. This graph is just to explain why the number of people who can donate is actually small. We all might want to support donation, but only 1% of our population can actually support donation. Because in order to be able to donate solid organs, we have to die in an intensive care unit on life support. So if you take the UK population and then look at the number of deaths in hospital, because it can't be facilitated at home, then the number of potential donors are only 6,794. Of those donors, they have to be eligible to donate. They shouldn't have certain illnesses. And then those referred potential donors, even if we approached all of them, the percentage that actually consent to donation, that is their families say yes, falls. And so the actual number of donors from potential donors of 6,794 reduces to only 1,510. But that 1,510 actually saves so many lives, because as a result of 1,510 donors, we actually had 3,713 transplants. What is organ and tissue donation? We can donate our solid organs, our liver, our kidneys, our intestine, our pancreas, our heart. We can donate our tissues, such as heart valves, skin, tendons, and corneas. Deceased donation, or donation after death, can happen after brainstem death, which was previously called heart beating donation, or after circulatory death, which is non-heart beating donation. If you have a catastrophic brain injury, either from trauma or from any other injury, then you can be on a ventilator, and it becomes very, very clear and obvious to the medical team that if we detached you from the ventilator, there is no prospect of survival. The brainstem, which is the important bit of our brain that controls our circulation and respiration, actually dies as a result of the brain injury. Those patients then proceed to heart beating donation. However, we also have another group of patients who are on life support, where we deem, along with the family and along with the multidisciplinary team, that continuing care in intensive care units, continuing on organ support, is actually not going to change outcome. And then in these patients, we withdraw life support, and the withdrawal of life support is now often done in the operating theatre with the family with them, with the nurse who's looked after them in intensive care with them. And then once we withdraw care and they die, we then proceed with non-heart beating donation. The difficulty with non-heart beating donation is the clinical team have to predict that that patient will die within 3 hours of us withdrawing life support. And the reason that those 3 hours are crucial is the organs start losing their viability and start degrading once we withdraw life support. And so we do have other techniques now to improve the viability. So if the patient does not demise within the 3 hours, those organs would really not be able to change the sort of lives of those people who are going to receive the transplants. Tissues and corneas, on the other hand, can be retrieved up to 48 hours after death. You can die anywhere in the hospital or in a hospice. And if you say yes to corneas and tissues, they can be retrieved by the Scottish National Team up to 48 hours after death. What happens in intensive care? When we admit someone in intensive care, we do so with the hope of saving them. So it's curative care. But unfortunately, in a small number of patients, we know that continuing intensive care is not going to change outcome. We then approach the family about end of life, but now, as a result of the law change, we also approach every family about the known wishes of their family member regarding organ donation. In many units, we use something called the COMFORT tool. COMFORT is an acronym for C, consensus decision, O, consider organ donation, M, medical documentation, F, family, R, religious and spiritual needs, and T, tasks such as keepsakes, fingerprints, and things to build memories about the patient. When we can't cure, we still care. And we still have the opportunity, and a very, very precious opportunity, to actually respect the dying wish of the patient. And if the patient supported organ donation, we have an opportunity to facilitate that. NHS Blood and Transplant is the overarching service which actually coordinates the NHS Organ Donor Register, the National Transplant Register, and they employ regional teams. Each ICU in the UK has an embedded specialist nurse in organ donation and a clinical lead for organ donation who are responsible for supporting and promoting organ donation within that unit. Once we actually approach a family, about end of life, we also refer the patient to the specialist nurse in organ donation. They then accompany us for the donation conversation with the family. They seek consent from the family, and in Scotland, that's called authorization. They then have to perhaps sometimes do tests, speak to the GPs, get more information about the personal and health records of the patient, and also intervene to improve the sort of physiology of the donor to make sure that the gift of life that they're giving people actually was gives them the best chance. They then coordinate with the retrieval teams, which we have retrieval teams all over Scotland and the UK. Sometimes if we are going to proceed with lung donation, we often have a retrieval team, a thoracic team that might either come from Newcastle or further down south. And then transplants happen. When someone dies in an intensive care unit and has said yes to donation, then there can be up to 9 people who are waiting for this life-saving transplant who have been phoned in to bring their bag. And these patients who are on a transplant waiting list are often waiting, praying that that call will come. And they will then be asked to go to their local hospital. And once the organs are retrieved, they will be transported across the UK, sometimes in Scotland, sometimes Northern Ireland, and sometimes the rest of the UK, to actually save lives of these patients who are waiting. We support the families who have made this brave and courageous decision to donate. And actually, there is a very, very formal ceremony where the families are given the Order of St. John, because we recognize that at the moment of greatest grief, they've made this really generous decision, this really brave decision that is of no benefit to themselves, but benefit to people that they don't even know. We give these gold heart pins to our donor families to honor their loved ones. We build memories. Our nurses in our intensive care and the specialist nurses in organ donation often create keepsakes that the family can take away, which we know is a very, very small token, a very small consolation for what they have lost. The magnitude of what they have lost is far bigger than what we can do for them. But it is an opportunity for us to recognize the legacy that they have left behind. By saying yes to donation, they can save up to 9 lives. And by saying yes to corneal donation and tissue donation, they can also enhance the lives of others by giving them sight. In the UK, up until 2015 in Wales and 2020 in England, 2021 in Scotland, and 2023 in Northern Ireland, we had an opt-in system. So patients or members of the public registered their decision to donate by registering on the organ donor website. They may have been asked by their wishes about donation when they register at a GP or when they actually apply for their driving license. But the society in the UK was so supportive of organ donation. 98% of people in the UK would accept a transplant if that was the only chance, the only option to save their life. And over 70% of them would support donation. So in 2015, Wales moved to an opt-out system where everyone is deemed to support donation. So even if they've not registered on the website, it is presumed that they would support donation if they were in a position to donate. The Human Tissue Act in Scotland came into force in 2021. And in England, it was 2020. So as you can remember, this was the middle of the start of the pandemic. And it actually is a testament to how our society supports donation, because it was actually a cross-parliamentary thing. It was proposed by Labour, but was actually carried out by Theresa May and her Conservative government. In England, it's called Max and Kira's Law. In the photographs that you can see, Max Johnson, the one who has a tube in his nose, was waiting for a life-saving heart transplant. Tragically, Kira Ball died in a road traffic collision. Her family were generous and brave enough to say yes to donation. In the photograph below, you can see that Kira's dad is listening to her heart in Max. And Max and Kira's family worked tirelessly together to bring about a law change in England. And that's why it's called Max and Kira's Law. In Scotland, the law came into force in 2021, but it's called the Human Tissue Act Scotland 2019. And it provides us with the responsibility to approach every family and ask them about their loved one who's currently on life support, their latest known wishes about donation. It's called the Duty to Inquire conversation. It formalizes the family conversation, and it ensures that the potential donor's latest views are brought forward. It ensures the donation doesn't go ahead if the donor was against their views, and it establishes the correct authorization route and provides assurance for clinicians that appropriate checks have been undertaken. The law is actually a huge improvement on what it was before, because it actually now gives us a very clear legal framework to proceed with speaking to families about donation. If the patient has not recorded a donation decision in writing, the Act provides that authorization for donation for transplantation may be deemed to have been given subject to a number of safeguards. There are 3 exceptions. If they're under 16, then we can't presume actually consent. Having said that, some youngsters do actually register or have told their families. If they're not normally resident of Scotland, or if the person has learning difficulties and we think that they're incapable of understanding the consequences of donation. It also makes it very clear what pre-death checks and procedures we can do. However, this is a soft opt-out, because even if they haven't objected to donation and they haven't opted out, the family can say no and we can't proceed with donation. It also gives us an order of relatives to make it very clear who we approach and what the hierarchy is. So the adult spouse, the civil partner, and as you can see, it goes down the various things. But all this is enshrined in law. There are lots of myths about organ donation. One of the myths that we hear very often is that doctors will not try hard to save my relative if he's an organ donor. Doctors will always try their best to save the life of the patient, but for a small number of patients, continuing life support is futile. The decision to actually change focus of care to comfort and dignity is taken by the entire multidisciplinary team. And even if there's one team member who's a dissenting voice, then we'll always err on the side of caution and continue treatment. My faith does not allow donation. No faith explicitly forbids donation. At the time our scriptures were written, either the Quran, the Torah, the Gita, or the Bible, organ donation was beyond the realms of possibility. So to look at faith scriptures and look for explicit sanction for donation is perhaps a bit unrealistic. However, our faith leaders all support donation, and all our faiths support donation of any kind. Saving a life is seen as the biggest gift that you can do. We have worked a lot with faith leaders in Scotland. In fact, in Scotland, we had the first Imams seminar in 2019, where they came together to actually worked towards a framework for supporting donation amongst the Muslim community. We've also had very good support from the other religious communities. In Scotland, we're also fortunate enough to have a faith and beliefs declaration in the organ donor website. So our teams know if you tick this box about your specific faith and cultural needs, then our teams actually know by looking at the website, looking at the register, that you have done that. And it allows us to actually approach you in a more culturally competent way. I'm too old or too sick to donate. There is no age limit for becoming an organ donor, and the decision about whether you can donate will be made by the specialist at the time, taking into account your medical, travel, and social history. This is a letter, and I'm just going to give you some time to read it. It's a letter written by a transplant recipient to their donor family. It says, firstly, I would like to say how sorry I am for your loss. I hope you can take some small comfort from the knowledge that you and your loved one have turned your tragedy into the most precious gifts, the gift of life and of hope. After 10 difficult years in dialysis, my dad received the priceless gift of life. I'm heartened to know that my children will grow in the knowledge that there are brave, selfless people in the world. They're looking forward to many adventures with Europa. Thank you will never be enough, but please know that you and your loved one are in our thoughts always. Our specialist nurses in organ donation will always help transplant recipients actually write and express their gratitude to donor families. Some donor families are still in the sort of the raw period of the grief where they may not wish to receive a letter, but there are some donor families who get a lot of comfort from reading this. Sorry, my slides are... So families, because of a soft opt-out system, families are the most crucial members of the donation conversation. 65% of white families say yes. Around 30% of Black and ethnic minority families say yes. So we plan a lot. And the reason for families to say no is mistrust of the medical establishment, religious and cultural barriers, and most often is just not knowing what their loved one would have wished. At this stage, when families are grappling with grief, with loss, with anxiety, it's quite hard for them to say yes to something that is of no benefit to their dying relative. If 85% of our families would say yes, we would have 500 additional donors in the UK. Our ethnic minority families and mixed heritage patients are more likely to need transplants because of kidney disease. If you look at our transplant waiting list for kidneys, 30% of our transplant waiting lists are occupied by Black and ethnic minority patients. Our ethnic minority and mixed heritage patients are less likely to find donors, particularly well-matched donors, because certain blood groups are more common in Black and ethnic minorities. This is a ticking time bomb in the UK because 1 in 5 adults in the UK are of ethnic minority heritage or mixed race, but 1 in 3 school children in the UK are of ethnic minority heritage or mixed race. It is testament to the great multi-ethnicity of our society that we have such a diverse society, but it also does mean that we need more people to be aware of our organ donation and more people to actually understand enough to be able to say yes. We also wonder whether the reduced numbers of BAME donors is because of health inequalities. While we might think it's because they're not saying yes, it might also be because of an inconvenient truth about the fact that there have been inequalities in society and they've actually not received access to either the life-saving organ or to actually chronic care, which prevents them from then donating because they already have hypertension and diabetes. So even if they wish to donate, they're not well enough to donate. It might also be the reason why after receiving a transplant, the outcomes are not so good. And we are certainly Kidney Research UK, who's one of our charity partners, is working a lot on prevention. It's all very well to try and match donors and transplant recipients, but it's also to prevent people's chronic disease to progress to the extent that they're needing transplants. The harsh statistics is that if you are listed for a kidney transplant, if you're white, then 70% of them will receive a matched organ within a year, but only sort of 52% will if they're BAME patients. I'd like to also focus on corneal donation. Corneal donation rates per million population in the UK is 38.3, but in Scotland is far less, 10.8. Patients and families often struggle with saying yes to corneal donation. One, it is lack of an awareness about the fact that actually it can save the sight of people. Also, they opt in for organs but opt out for corneas because they're worried about the disfigurement, which might actually hinder burial and cremations. Corneal blindness is perhaps the only sort of curable blindness because it can be cured with a transplant. And the people who are on the transplant waiting list for corneas are often very elderly and stoic. And in some ways, we don't have enough data on the impact it has on their carers. If you're an elderly person and you can't see and you're becoming blind, it might mean that your relative will have to give up their job to look after you. It might mean that you're unable to work, and it has a huge impact. By saying yes to corneal donation, we can actually save the sight of people. This photograph is of Angharad from CBeebies. She has a very rare hereditary blindness, but she was lucky enough to receive corneal transplants, which help her get the sensitivity of light. And her families are now tirelessly advocating for people to say yes to corneal donation. There are some myths about corneal donation. The eye is never transplanted as a whole. It's only a layer of the eye that is actually retrieved. Corneal donation can give sight, which can change, transform patients' lives. You can still donate if you have most types of cancer, and you can donate if your vision is poor. NHS Greater Glasgow and Clyde is committed to increasing the number of transplants, both corneal and solid organ, for our patients. The Commonwealth Games is going to happen in 2026 in Glasgow, and we're working with our Commonwealth partners, India, Canada, and Australia, to actually try and work with them to improve awareness about organ donation, and we have lots of initiatives. We are also working with the Realistic Medicine team and about importance of information, equity of access to information, and to actually give our patients information about organ donation and tissue donation at the stage when they are planning anticipatory care. Why is it important to consider being an organ donor? In Scotland, more than 500 people are waiting for a transplant. One donor can save or transform the lives of up to 9 people. And by donating corneas or tissues, we can actually give them hope and transform their lives. Because less than 1% of us will die in a way which means we can be a donor, it's even more important that we make a decision and discuss it with our family member. 77% of people in Scotland support donation, but only 53% are registered on a website. So although we have opt-out, if your family don't know your wishes, they are likely to say no. The most powerful message to your families is actually knowing that you've thought about it, you've made a decision, and you've actually registered on a website. So when we go and tell them that your family member is actually registered on the organ donor website, it takes away, in many ways, that burden of responsibility from them, because then all that they're doing is respecting your dying wish. Our appeal to yourselves is that there is an opportunity here to help at no cost to ourselves. Our organs and our tissues get buried or cremated when we die. Donation is almost like sort of supporting the environment, saving the environment. By saying yes and sharing that information with our loved ones, we can save up to 9 lives and give sight to a couple and transform a few others. So we appeal to you to actually think about it seriously, make a decision, and register that decision. Thank you very much.
Well, wow, thank you so much for that. That was so interesting. I've got loads and loads of questions, but also I'm hoping that people on the call also have questions as well. Hopefully you can see all the claps that are going on as well. If you do have questions, just a little reminder, you can pop any questions into the chat button that the chat that we have down the side of the screen, or if you'd like to, you can stick up your hand. There should be a little like hand icon somewhere on your screen that says raise, and if you'd like to ask a question in person, you're very welcome to do so. We can activate your cameras and your microphones. But while you guys are having a think about that, I'm going to just kick off with some questions that are in my own mind. And one of the ones that we'd had through when people were registering was a question about whether or not it's possible to request that certain organs go to certain people, in the same way that I guess you might request that a painting goes to a certain family member. So is that possible? What's the logistics of that like?
So it's called directed donation, and you can't make a sort of, I guess, request like I only wanted to go to a member of my religion or my ethnic heritage. You could, if you had a family member who was on a transplant waiting list. And we've had examples where someone would actually would have been worked up to be a living donor to their relative. And unfortunately, something bad happens and they end up in intensive care. And then we have actually directed that donation to the member that they were already going to sort of donate to. The legal requirements for this are very, very clear. It is a lot, but a lot of requirements have to be satisfied. But you certainly cannot make requests like, I don't want my organ to go to a member of a certain faith or only to a member of a certain faith. So you can't do that.
Okay. And I think I remember a few years back reading something, or maybe I watched like a episode of Grey's Anatomy, so this might not actually happen. But it was about living donations of kidneys in a kind of almost joint networks where people were giving. So does that happen quite often? And what are the logistics of that? How do you find the people who join up and make that situation happen?
I know it's quite impressive. It's called paired donation. So living donation can be altruistic. You don't have to be in the UK. You don't have to be related. There are lots of psychological assessments, and the Human Tissue Authority actually has to do very careful assessments of, whether you understand why you wish to donate and what the consequences of it are going to be for you. But then, for example, if I would like to donate to my husband, but I'm actually not a match, then I could donate. And then there'd be someone else who's waiting for a kidney who might be a match for, but my husband would get the kidney of someone else's. And it's actually an algorithm in today's sort of, AI days. But even before that, it's an algorithm that matches. And patients go into their respective hospitals and actually donate their kidneys. It happens with kidneys, donate their kidneys, and then it gets transplanted along as a chain. And it's quite marvelous.
And so there's obviously kidney donation. Are there other kind of live donations that you can do with other organs?
So livers, you can donate a small portion of your liver as liver donation. We aren't at the stage where you can donate any other organs. As you can imagine, you can't really donate your heart because you've got to continue to live after that.
Yeah. Okay. And so I guess with this idea of, you might match with someone else and someone else might match, what are the actual chances of you matching with a stranger? Is there lots of criteria that they need to sync up, and how common is that criteria?
Yeah, it's fair. Actually, the chance of your matching with a stranger are small. For kidney, certainly it's your blood group, and there are 6 antigens that have to match. But the chances of your needing a transplant are much higher than your chances of ever being able to donate. We're all 5 times more likely to need a transplant than we're going to be in any position to donate. So, I mean, as you can see, there are 7,000 people waiting for a transplant. So the likelihood, if you do wish to do an altruistic donation, the likelihood that you will match with someone is quite high. And certain blood groups are very, very common. And, the law of statistical averages are those that it'll also be represented in the waiting list patients. So you'll match.
Yeah.
If you have a very common blood group, then you'll probably match quite readily. But there's lots of testing that is needed.
And are there organs that are kind of more commonly needed, or are there rare
Kidneys,
organs that are needed?
kidneys are most
And I guess
commonly
that's good
needed.
because you can do a live donation to that. I guess if you donate your kidney and then your other kidney later on in your life fails, does that like boost you up the list of getting a new kidney, or are you in the same position as you were? You've just done something very altruistic.
I'm afraid I don't know. I don't think we have enough data. One of the things is that once you have donated your kidney, you have to be in very good health for them to agree for you to donate your kidney. If you are, then the actual risk of complications is quite small. And then you get very, very frequent checkups to make sure that you never get a disease. Can't say never, but you are looked after very well. But I'm afraid I really don't know if you get boosted up. I guess one has to acknowledge this priceless altruistic gift that you have given.
Yeah.
So there must be some consideration of that.
There we go. There's some motivation for folks. So we've got a question from in the chat about what happens to your bad kidney. Can you keep it and have it cremated, for example, or does it stay in the body? What happens to the kind of the bad organs?
So most often the bad organs remain in your body. So your kidney that doesn't work often shrinks, and we call it becomes atrophic. So there was a BBC article about someone who had like 3 kidneys because they got 2 transplants. So you can have atrophic. Sometimes they have to, for example, patients may have a condition called polycystic kidney disease, and those patients, often their kidneys become very big and cause pressure on other organs. So for them, their kidneys aren't working, they become very big, so they will take that out. They call it a nephrectomy.
Ah, right. Okay, okay. Oh, see, all this good information. So we talked a lot tonight about families and about the importance of engaging with families and understand or getting them to understand your wishes. So if, for instance, I had opted, well, I'd registered my wishes and it was written all over my future care plans that I wanted to donate all of my body, do my family still have the right to say, actually, no, we don't want that to happen? Or would the fact that I had kind of recorded it so well kind of trump that? Or is it just a case of me really having to have a good conversation with my family and say, I realize that you guys might not be keen, but it's really important to me?
So it's very interesting that you asked this, and we are often challenged on this. We find that if you have registered and we tell the family, they often say yes. However, if they say no, it's a soft opt out. We do tell them it's unlawful for them to go against your wishes. Because, for example, if in health you were going to have an operation, you're the only one who's asked for consent. And your family can't say, well, I don't want her to have an appendicectomy. They can't. So why is it with organ donation that we actually uphold the family's views over your views, and the reason, or your express consent? And the reason for that is of two. One, families are so grief stricken, to put them through this sort of challenging conversation is actually very, very difficult. The second is we need the cooperation of the families for a lot of personal information about the donor, because we need to go through their medical records with a fine-tooth comb. And so particularly if they are resisting it for whatever reason, it might be a grief reaction, it might be something else, some trauma, we find it very hard to facilitate it then. But as I say, in practice, what happens is if you have registered, families say yes, even if they think they would not want to, they do say yes because they don't want to go against your sort of dying wish. And the fact that you've actually taken the trouble to register it is very, very powerful.
Grand. So we've got another question in the chat about when the donor recipient dies, can the donor family ask for the donated organ back, or does it stay with the organ recipient?
It's quite anonymous. So it's only recently that actually families are told about who the recipients are. They ask, and who the recipients are told who their donors are. But it's very carefully done because there shouldn't be any sort of trauma. I mean, receiving a transplant, although life-saving, also puts a huge burden of guilt. And we do realize now that we need to support our transplant recipients with more psychological support, because the fact that someone has died and you've received something from them and that family is still grieving is quite a burden to carry for the transplant recipient.
Mhm.
So I am not aware of any donor family that would ask for their donated organ back. I think often, um, and they wouldn't know if the recipient has died
Mhm.
because it's so anonymous.
Yeah. And I guess we talk a lot about the gift that we are giving and how rare it is for these organs to be available. But when we watch sci-fi or we read sci-fi many years in the future, we talk about kind of lab grown organs, and sometimes in the news as well, you hear different things. So are we at a point in time where like actually lab grown organs may be used, or are they already being used? Where are we kind of at with that side of things?
So certainly for corneal transplants, there is more and more work that's being done with the biocompatible sort of tissue. I mean, they are grown in a lab rather than actually retrieved from a patient. Sort of biocompatible membranes that would act, because the cornea is actually just like the windscreen of a car, just a very, very clear thing. So we're nearer that. Stem cells, they are pluripotent, they can transform, so that stem cells are being used. But last year in America, they did transplant a pig's kidney into a lady, and I think she's still doing really well. So there might be, because one of the difficulties we have with an aging population all over the world is that, yes, of course, we are needing needing these organs for transplant recipients, but our donors are also living longer and have lots of comorbidities. So their organs perhaps are of marginal quality to be able to be transplanted. And so we do need to actually invest more in research about how we can have lab grown organs.
Yeah.
But I think sort of kidneys and for hearts, they have had sort of devices rather than biocompatible devices rather than actually lab grown hearts.
So yeah, so sometimes it's the plumbing and it's
Yeah,
the valves and things
yeah.
like that might be used. And the the kind of one of the things that we talk a lot about in our program is doing future care planning, having conversations and thinking about what's important to you, but also thinking about the things that we can do right now to help us achieve the things that we want. So if you could ask us to do anything to kind of ensure the quality of our organs, shall we say, like is it just that we should be like living, a healthy life as possible, or are there other things that we can be doing? Should we all be taking supplements of vitamins of all sorts?
They just live a healthy life, and none of us want to be, and none of us want to see our family member in a position where they're on life support or we're having to make this decision. But when we go and speak to schools, we do a lot of work with schools because at 16 in Scotland you do receive a letter. The government sends you a letter about opt out, because once you're over 16 you are presumed to support organ donation. Often there is this huge discussion about equity of access and reciprocity. So if we are willing to receive a transplant, then we should be willing to donate. And our youth often say, if I'm going to die, those organs are of no use to me. So why, if they can be of use to someone else? I mean, today's youth are all using Vinted and Depop, and they're recycling everything. So actually, why not recycle our organs?
Absolutely. So do you think that actually there's a kind of age change, and actually we will see many more people donating their organs as kind of this new generation comes in? So actually, us of the older generations, we might manage to have more organs that we can use.
But I think the youth are actually change makers. They're agents of change. So while they may not be in a one hopes they live their full life and doesn't end up in life support, but they might be a part of a donation conversation about their grandparent or their aunt or their parent, and they might be able to actually support and empower their family member to say yes at that point. And that's what I think will make a difference.
Absolutely, yes. We look to the youth for change. One of the other things that we talk about a lot in our work is kind of preferred place of death, and where would people want to die? And there's lots of research, and everyone kind of seems to think everyone would really like to die in their home. But you mentioned that actually with the kind of process that needs to be happening for organ and tissue donation, it really needs to be in a more clinical situation, so a hospital and a hospice. So if it is our wish to give our organs away, and we maybe are on a palliative care pathway and we're coming towards kind of the end of our lives, should we actually be talking to the district nurses, the GPs, and actually really advocating that we do want to die in hospital and this is the reason for it, rather than us being kind of in those skewed statistics of, oh, we didn't manage to provide a death in the community? Should we actually be having conversations about the importance of dying in a hospital, or is the kind of capacity of hospitals not at that stage yet?
Yeah, but I think as I said, less than 1% are going to be able to donate solid organs. And actually, if our wish is to die at home, we should facilitate that. But there is an opportunity for them to donate corneas and
Mhm.
tissues while they can't donate solid organs, and that can be retrieved from a hospice or from home as well. Home is more difficult, but certainly from a hospice, and a lot of work is being done in England with palliative care teams and district nurses and training up professionals to be able to retrieve corneas and tissues.
Okay.
Um, in terms of dying, I think it's such dying is quite is not just a sort of clinical biological process. It has got so much significance rooted in faith and culture that it's important that we die, or we express a wish to die where we would feel most comfortable. And home seems to be, I mean, there's more and more evidence that people would wish to actually go home. We try our best to accommodate end of life wishes of all communities, and certainly for a Jewish and Muslim patients, they wish their last rites are about burial within 24 hours. And even if they expressed a wish to donate, then if the donation process is going to take any longer, we're very upfront with them, and they have the opportunity to say no because it might actually not align. We find that with our work with ethnic minority communities, there is no barriers. They're not saying no to donation. They understand their need for donation. It's just aligning their end of life care practices with the donation process, and actually empowering us as medical professionals and nursing professionals to be more culturally competent. So when we go and have that information sort of conversation with them, we're actually armed with a lot of information and respect for their beliefs and their needs.
Absolutely. We did an event last year with the spiritual care team about kind of those cultural and spiritual beliefs at end of life. And it was so interesting, and just as you say, making sure that our workforce is skilled up and understands the kind of the conversations and how to phrase those conversations and what actually might be important and also what might not be important to people as well is really, really important. So yeah, having that kind of cultural awareness, and it's such an interesting fact. Like I love hearing all about all different religions and their approaches at end of life. One of the other organisations that we did some work with last May for Demystifying Death Week is an organisation called Pushing Up the Daisies, and they kind of empower and advocate for people to be able to care for bodies at home after they've died. And they talk about the fact that actually, yes, bodies can be brought back from hospitals, hospice, care home into the home. So is that the same with a body that's had organs donated? They can be brought back into the home. There's nothing. There's no like, oh well, we've got stitches or anything like that. It's
No,
absolutely
no,
fine.
no. I mean, the operations to retrieve organs are done as respectfully as they would be done in health. So it's a scar like you would have if you had your gallbladder out or your appendix out. It isn't any different. Even with corneal retrievals, you wouldn't know that they've actually donated the cornea. It's done so carefully and so sort of respectfully. Yeah, you can. The only times that you can't is if we've had to make a referral to the procurator fiscal, because the circumstances of the death have to be discussed with them. And then, the processes are different. You can still donate. The procurator fiscals in Scotland are very, very supportive of organ donation. So even if there is police involvement, they will often say yes to allow us to proceed with donation if the family say yes.
Oh, fantastic. So we've got another question here about how can you be assessed to see if you're suitable for donating organs? Do you have to wait until you kind of like those conversations appear, or can we be proactive in this kind of assessment?
I think if you were going to be living donor and you're thinking about it, you could ask your GP and you'll get referred and then you'll get assessed for it. There's not just physical assessments, but lots of psychological assessments as well. But actually, if you lead a good life and you don't have any health problems, you don't have any comorbidities, you're not on any medication, you're physically active, there's no reason why you shouldn't be able to donate if you were in the unlucky position to be on life support. There's no reason why you shouldn't be able to donate.
So I saw
Sometimes
on
you're, sorry.
oh sorry, I was gonna say I saw on the website that it said, even an 80-year-old kidney is fantastic. And I thought, oh, that's great. I'll
Yeah,
be
yeah,
yeah.
yeah, it is. It is. And also, it also depends on your acute illness that has made you end up on life support. So, that can change things. So if you have sort of sepsis that is uncontrolled, then the fear that we have is if we then retrieve those organs and transplant them, we might be transmitting infection. So, there are lots of other things. But if you have sepsis that has been treated with antibiotics, it's different. So, but there's so many tests that the specialist nurse and organ donation do along with ourselves in ICU and their GP. Lots of information is collated. It's quite a forensic approach just to make sure, because the transplant recipients are such a vulnerable and fragile group. They've already been waiting for this. We don't want this gift has to be in its best form ever to be able to
Absolutely.
actually change their lives.
And given the kind of the stats around cancer and how many that affects people, does a cancer diagnosis kind of exclude you from any kind of donation, or is it kind of taken as case by case and you might be able to donate some things and not others?
Yeah, case by case. Certainly, it does. I can still donate corneas and tissues. Again, but it depends on certain cancers as well. So
Okay. Oh, such a myriad of questions, but thank you so much for such an informative evening. It's been absolutely incredible. Time has flown by. Thank you all for your questions. If anybody has any kind of final question that they're dying to ask, then please do pop your hand up, or you can pop it in the chat quickly. I'll just double check to see if there's any emails that have come through with frantic questions. We have been recording tonight's event, so we will be getting the video up on our website as quickly as possible, as soon as I can get the editing completed, and we will be sending you information about where you can watch that, so you can also share it with your friends and family, and maybe that's a good way to start these conversations that we are kind of promote with someone. Do some myth busting yourself. We have also popped in the link to register your wishes with Organ Donation Scotland. That would be fantastic. Hopefully, what a great advert for the kind of the power of organ donation that we've had tonight. And as I say, it's been absolutely wonderful. We will be sending out a short evaluation after tonight, and we'd really love to hear your feedback and if there's any other topics that you would like us to touch upon. We also have some more events coming up this week. About tomorrow, we have an event about power of attorney. So if you don't have your power of attorney sorted out yet, or you're not quite sure what it is or why it's important, then that's a really great session that you can come along to. And then on Wednesday night, we are doing a session about kind of thinking of the future and maybe preparing for any crisis that might arrive even in the next 10 years. So what are the kind of things we can do right now to help prepare for those things, paperwork wise, learning about what you could maybe put in your grab bag. I was really interested to hear about people who are waiting for an organ to be donated and they have their own grab bags. That's fantastic to see that. So you can come along to that. That is Wednesday night. There's also a whole load of events happening all across Scotland and all across the rest of the UK as well. In the rest of the UK, it is Dying Matters Week. Basically the same thing. We all just want to chat about death and dying and kind of bust taboos and make sure that people can have the conversations that they need to. I hope you can see all these wonderful thank yous pouring in through the chat as well. But thank you all to everyone. Oh, Rad is also happy to share her presentation, so we'll add that to the evaluation that comes out tonight so that you guys can see that. Any questions, please do just get in touch with us. We love chatting about these things and love facilitating the events. So thank you so much for giving up some of your bank holiday weekend. And I hope you all have a lovely short week for the rest of the week, but do come along to any other events. And lastly, just a massive thank you to Rada. That was amazing. And yeah, have a wonderful night, everybody. And we'll see you all hopefully soon.
Thank you so much. Thank you for giving up your bank holiday Monday.